Thank you everyone for coming so much. I hope that you can come away and just learn a little bit more about Narcan and the opioid crisis. And even if hopefully you never have to use this, it's still important information to know and for people in the community to be aware of. So, just some general information about the opioid crisis. So opioids themselves interact with opioid receptors on nerve cells in the body and the brain. So opioid pain relievers can be safe when they're used and for a very short time as they're prescribed exactly by a doctor, but they are very easily misused due to the fact that they produce euphoria in addition to pain relief. So misuse of opioids refers to taking them in a manner that is different than how your doctor prescribed them, so in a larger quantity or for a longer time than prescribed, or even just without a doctor's prescription. So regular use, even as it is prescribed by a doctor, can very easily lead to a dependence, which in itself can lead to addiction, overdose incidents, and in the most extreme case, death. So in Massachusetts, opioid overdose is the leading cause of injury death. In 2016, we had a confirmed 2,083 opioid-related deaths, an estimated 2,149. And in 2017, we did see a 6% decrease in opioid-related deaths, which was the first time in 7 years that that death rate decreased. So there's a confirmed 1,874 deaths in an estimated 2016. So even though there was a decrease in the number of people who died from opioid overdose, this is still very much a large problem in Massachusetts and even in our own town, because it's still a highly significant number. And so opioid use has gotten a lot more severe due to the fact that now there's a lot more use of fentanyl, which is now the drug to make up the highest percent of opioid-related deaths in Massachusetts as of 2016 and 2017. So in 2017, of the 1,775 people who had opioid-related deaths, 1,507 of them, which is 85%, had a positive screen result for fentanyl. So clearly fentanyl is highly related to opioid overdose. So in the fourth quarter of 2017, we can see that heroin was present in about 44% of the deaths, cocaine was present in 49%, and benzodiazepines were present in about 38%. So luckily, there is a positive trend in that since the beginning of 2014, the percentage of opioid-related overdose deaths due to prescription drugs has trended downward, but of course that now means that the rest of those deaths have come from street drugs. So even though there's less prescription drugs that are causing overdoses, it's still being made up and we're still seeing a high number of overdoses in Massachusetts. So if we look at the demographics in Massachusetts, and this is looking at the deaths in 2017, of which there were 1,874, 76% were male, 23.6% were female. By age, the highest age group was from 24 to 34, which is 30.7%. The following age group was 35 to 44, which is 24.1%. And after that is 45 to 54, which is 22.8%. But we still see that there are people from 15 to 24 years old who are dying of opioid overdose. That's 6.7%, which is not a lot of the entire majority, but it's still a significant amount. And we see the same for 55 to 64-year-olds and 65 plus. So if you combine those, that's about 15% right there. So by race, the vast majority is people who are white, 80.6%. People who died of opioid overdose in 2017 were white people. Following that is people who are Hispanic, 11.8%. Following that is people who are black, 5.5%. Following that is other/unknown, but that doesn't really matter. And following that is Asian, 0.6%. So now what is Narcan? So I have some Narcan here with me. This is the actual dose of Narcan that people can use. So this here is 4 milligrams of Narcan nasal spray. And so Narcan is the brand name for the nasal spray form of the medication naloxone, which is an opioid receptor antagonist. So it means that it binds to opioid receptors and it reverses or blocks the effect of opioids. So an opioid overdose can be reversed by using naloxone in the form of Narcan specifically, which is what we're focusing on today. For fire departments and ambulances, they can use naloxone in other forms such as intramuscular or an IV, but we're focusing on Narcan today because it's a nasal spray and it's much, much easier to use. So it can be applied into the nostril by both trained and untrained users, and in the majority of cases, giving Narcan will very quickly reverse the effects of opioid drugs and restore normal respiration. But since now there has been more extreme cases of the opioid epidemic, since there's a lot more fentanyl and heroin being used, there have been more cases where more than one dose was necessary. So now, why is Narcan relevant to you? Because I know, personally speaking, it doesn't seem like the opioid epidemic is all that important to me personally, because I don't know of anyone myself who has died of an opioid overdose. But if you look at the stats and the information, there is a very large number of people in our state, in our town, in our community who are affected by the opioid epidemic, who we as a community should step up and learn how to take care of this. So the U.S. Surgeon General himself actually issued a very rare national advisory on April 2018, which urged more Americans to carry naloxone and learn how to use it. And so just to put that into perspective, the last time that a Surgeon General issued a warning that urgent to the country was in 2005, when the then Surgeon General advised women not to drink alcohol when pregnant. So people of all socioeconomic backgrounds are affected by addiction and the opioid epidemic, even if it seems like to you that no one in your neighborhood, in your town, or of the people you know would be affected by this problem. Given how widespread this problem is, it's very likely that someone you know could be struggling with this, even if you aren't aware of it. And so even though Narcan is carried by emergency medical personnel and other first responders, it can be too late sometimes to save someone by the time that they arrive. So from 1996 to 2014, at least 26,500 overdoses were reversed by laypersons. So that means people like you and me who don't have any special training to use Narcan, who this isn't their job, they're not first responders, they're not workers in the healthcare field, but they themselves were able to save lives. So also research shows, and this is a study that actually involved a town in Massachusetts, that when naloxone and overdose education are available to community members, overdose deaths in that town or community will decrease. So now, how do you identify an opioid overdose? So opioids suppress the body's urge to breathe, and so the biggest sign that someone has had an opioid overdose is if they are not breathing or if they are struggling to breathe. The other signs, which are less severe, they can include small pupils, they're unresponsive or they won't wake up, they have low blood pressure, they have pale or discolored skin, they have a slow heartbeat, they seem confused and they're vomiting, their skin is cold or clamming, and they are emitting a snoring noise, which is referred to as the death rattle. And so to make sure that someone is overdosing, you're going to do what is called a Sternum Ruff, which you might know about if you also have CPR first aid training. So basically you make a fist with your hand and you're going to rub up and down their sternum, like right here, as hard as you can. And the pain from that is so severe that if they do not react, then they are in dire need of medical attention because it's just so painful. So now, when you are using Narcan, steps you want to take are first, identify the overdose using the signs I just said. Secondly, you're going to call 911. And then next, you're going to give rescue breaths. So that's one breath every 5 seconds. And if they remain unresponsive after 30 seconds, you're going to want to administer Narcan. So to administer Narcan, you're going to remove the Narcan device from the package and hold it so that your thumb is on the bottom of the plunger and your fingers are on either side of the nozzle. So you're going to place and hold the tip of the nozzle in whichever nostril, it doesn't matter which one, until your fingers touch the bottom of the person's nose. Then you're going to press the plunger firmly to release the dose. Then once you've given the dose, you're going to continue to give rescue breaths. And if they're still unresponsive after 2 to 3 minutes, you're going to give a second dose. and then continue breaths until emergency responders arrive. And if they vomit, then you're going to place them on their side in what is known as rescue position to prevent them from choking on their vomit. And then you want to stay until first responders arrive. So if you know how to do first aid and CPR training, a lot of these steps are very similar, except that in the middle of rescue breaths, you also want to give Narcan. So that was kind of a lot of information to just throw at you. So I have a short video that was actually given to me by my advisor, Ms. Mori, that demonstrates how you would use Narcan. Oh.
Narcan nasal spray is an emergency treatment for a known or suspected opioid overdose. The appropriate use of Narcan nasal spray can help you save a life. Narcan nasal spray is not a substitute for emergency treatment.
Yeah. So while we deal with that, I have some Narcan that I'm just going to pass to either side. And just so you know what it looks like, so just pass it on. That's what it looks like in, that's the actual Narcan. So that's what the actual device, if you would have Narcan yourself, looks like.
Overdose. The appropriate use of Narcan
and then I'm also going to pass out this sample,
Narcan
just so like you see what it's like
to for emergency medical care. As with any drug, you need to be aware of important safety information concerning its use. If you encounter someone who is unresponsive and you suspect an overdose, first shake their shoulders and shout their name.
Kevin.
Ask if he or she is okay.
Hey,
Check for signs of an overdose. Unresponsive to touch or voice. Breathing is slow, uneven, or has stopped. Snoring, gasping, or gurgling sounds. Fingernails or lips are blue or purple. Administer Narcan nasal spray as quickly as possible if someone is unresponsive and an opioid overdose is suspected, even when in doubt, because prolonged respiratory depression may result in damage to the central nervous system or even death. Lay the person on their back to receive a dose of Narcan nasal spray. Remove Narcan nasal spray from the box. Peel back the tab with the circle to open it. Remove and review the printed quick start guide inside the package. Hold the Narcan nasal spray with your thumb on the bottom of the plunger and your first and middle fingers on either side of the nozzle. Do not press the plunger to test or prime the device. If you do, you will waste all or part of the dose of medication. Tilt the person's head back and provide support under the neck with your hand. Gently insert the tip of the nozzle into one nostril until your fingers on either side of the nozzle are against the person's nose. Press the plunger firmly to get the full dose of Narcan nasal spray. Remove the device from the nostril after giving the dose. After you have given this medication, seek emergency help right away. Narcan nasal spray is not a substitute for emergency medical care.
I'm with somebody who stopped breathing. I think they've had an overdose.
Move the person on their side after giving Narcan nasal spray. If possible, put their hands under their head and bend their upper leg forward. This helps prevent the person from rolling onto their stomach. This is known as the recovery position. Continue to watch the person closely. If they do not wake up or respond to your voice or touch, or if they do not seem to be breathing normally within 2 to 3 minutes, use a new Narcan nasal spray to give an additional dose in the other nostril.
Alright, so, and I'm making my way back on the other side because I can learn from my mistakes. Okay, so Narcan itself does not have any side effects unless you are allergic to naloxone hydrochloride, which is the main ingredient in Narcan, but it does cause withdrawal symptoms in people because of the rapid opioid reversal. So that can include body aches, diarrhea, increased heart rate, fever, runny nose, sneezing, goosebumps, sweating, yawning, nausea or vomiting, nervousness, restlessness or irritability, shivering or trembling, stomach cramping, weakness, and increased blood pressure. So these symptoms themselves, while they're very painful and they can be very uncomfortable, they aren't as dangerous as the actual overdose itself. So you're still going to want to administer Narcan despite the chance that these might happen. So the one exception, though, however, is in cases of infants under 4 weeks old, sudden opioid withdrawal can be life-threatening if it is not treated correctly. So now, who should carry it? So ideally, in a perfect world, everyone, I believe, should have Narcan in their homes, just because you don't know who in your lives is affected by the opioid epidemic, who maybe someone you know, someone in your family, someone on your street. But it's especially important for these people to have Narcan, and that includes people who knowingly live with or have close relationships with drug users, people on methadone or buprenorphine, patients who are taking high doses of prescribed opioids, people coming out of prisons or detox programs, because detoxing will actually cause their tolerance to lower. That might make it easier for someone to overdose. People who work in places where drug users might overdose, which includes places with public bathrooms or other facilities that they will congregate at, such as shopping center or parking lots. So now, if you yourself are interested in obtaining Narcan after everything I've told you, so it's available at all Massachusetts pharmacies with or without a prescription from your doctor, and that's because there's a statewide standing order. That means that anyone who wants to get Narcan in this state basically has a prescription written up for them already, and they are free to get as much Narcan as they want. So all you need to get for a kit under that standing order is an insurance card and a payment method, like with all prescriptions. So even though insurance coverage and copay costs vary, you can check with your healthcare company to see how much you'd have to pay out of pocket. People who have Mass Health insurance can get Narcan for either free or at a very low cost. And people whose lives are directly touched by the opioid epidemic, so that includes people who are part of the groups I mentioned earlier, they can actually visit AIDS Project Worcester, which is a great place in Worcester where you can go for one-on-one Narcan training, and they will give you 2 doses of free Narcan. So here are just some statistics relevant to Shrewsbury that I was able to get thanks to Mr. Towner from the fire department. So as you can see from each year, the number of calls dispatched, the number of doses of Narcan given, the number of patients who receive Narcan, there is an increasing trend. So even though we did have fewer deaths in 2017 than in 2016, you can see that there were more calls, there was more Narcan that needed to be given, and there were more patients who needed Narcan. So even though there might be fewer deaths now, and that comes from the fact that we have things like Narcan, naloxone that will reverse opioid overdoses, it's still a very large problem, and there's still many people who are affected by the opioid epidemic. So if you want to get more information, these are some websites I have. The first website, I actually compiled everything from my slideshow. So if you want to just see any of the information I presented today, that would be the place to go. And now we have Mr. Towner from the fire department, who can just speak to his own personal experience working with the fire department and in ambulances. So, yeah.
I'll just speak loudly. Can everybody hear me okay?
Yeah.
Thanks, Amber, for having me. I was able to help her with some statistics, but she asked me to provide kind of some firsthand knowledge of dealing with this specific patient population. I've been a firefighter in Shrewsbury for almost 15 years, and I've been a paramedic on the ambulance in Worcester for UMass Memorial EMS for about 8 years before. So we've kind of seen the trending with patients who are using opiates or overdosing on opiates. We've seen kind of these trends firsthand in real life. One of the things that we kind of remember about New England in general, or Massachusetts, central Massachusetts, is that opiates have kind of always been the drug of choice for street drugs. If you go to other parts of the country, you may see things like crystal meth or other drugs, but really in Massachusetts, it's always been opiates. What we've seen of an increase now, though, is the amount in the different patient populations that we're seeing. It's not just Someone who is maybe a recreational drug user who becomes hooked on opiates and graduates to heroin, is it could be patients that you may see in your own neighborhoods. There's kind of that typical story of a young athlete who gets an orthopedic injury, who is treated with opiates and then graduates to stronger and stronger opiates. Maybe they take them a different way, they snort them instead of taking them orally, and then they move on to heroin because they're not getting the same reaction they got before. There's that kind of standard story, but we're starting to see that now in younger population, in different populations, different socioeconomic populations. And it's now becoming more so that we're treating them more. You kind of could see on there that even though deaths have gone down, but you saw that the amount of calls and the amount of Narcan usage has gone up. A lot of that is because of the makeup of the heroin that we're seeing itself. Amber talked a bunch about how there's other drugs inside heroin. What we're seeing now is most heroin, this is from a toxicologist friend of mine that we just did some training with, 95% of the heroin tested lately has been fentanyl. Fentanyl is 1,000 times stronger than heroin itself. And the reason being is that if you were to take a package of heroin this big and try to smuggle it into the United States or move it from place to place, it's a lot easier to take a package of fentanyl that's a lot more, it's 1,000 times stronger, that's this big, and smuggle that. And they cut it down with a number of other things. That's why you're seeing things like cocaine in there, benzodiazepines, other things they can put in to make the volume bigger and keep the same concentration so that people who are using these drugs can still get the same effects they were getting before. So what you're seeing now is that we're giving more and more Narcan. In the past, maybe we would give 0.4 milligrams to 2 milligrams, say IV or intramuscular or nasally. Now sometimes we're hitting 3 and 4 dosage, just all the way up to 10 milligrams without any change. And at that point there, where it's we're securing an airway with a breathing tube and breathing for them until we can get them to some more definitive treatment in the emergency room. So you can kind of see where the trends go. Not only is there more people using opiates, but their final trip to, say, heroin or fentanyl, it's so strong that more and more people are overdosing. And especially now that more and more people are getting treatment, and it often takes 3 or 4 treatment programs for people to get clean for a long period of time, is that as people come out of treatment programs, they haven't used an opiate in a long time, and they go to use their normal amount, and they overdose again. So you can kind of see where the trends have gone. As far as in town here in Shrewsbury, those numbers kind of represent the diagnoses by the paramedics on the ambulance and the amount of calls they're doing. And you can see that it's still growing, but we're able to get there sooner and treat faster because of things like bystander Narcan. It used to be that we would show up with an overdose and it would be that person would be by themselves because maybe their friend or other drug users would call and then leave because they didn't want to get in trouble with the police. And now we're arriving to find family members treating their family members, or even other drug users staying with them because of the difference in education now in the way in which people are treating. One other thing to note too that I think is helping with deaths is that there was a law change. A couple of years ago they changed a lot. It used to be that you could only put people into protective custody for alcohol use. Now they've changed it so it's drug use also. So a police officer can go there and put somebody in protective custody and make them go to the emergency room to either be treated or seek services. They also changed a law now that if you were to call because someone is overdosing, no one there can be arrested unless they have so much product that it's not just for their own use, that it's for trafficking or things like that. So now instead of those, the person who's doing heroin and overdoses, instead of their friends leaving because they don't want to get in trouble, they're now staying with their friends and getting there until first responders can get there to treat them. So those are kind of some insight maybe into what we see and why these things are trending. It kind of shows the kind of the life side of the data itself. Anybody have any questions about any of that? Yes, ma'am.
How old do you have to be to be legally able to administer Narcan?
I don't think there's an age, as far as I know. I know you've seen any of that in your research, Amber.
No, I'm not.
No, I think anyone that can be trained to use it properly, it's like CPR. You see videos of infants doing CPR, kind of more funny, but there's a lot of places in the country where kids can't go to middle school without learning CPR, and this is kind of the same thing. If you can learn the skill and you can recognize when to use it, I think that really any age can use it. It really just becomes a safety issue there, and that person being safe with the patient. And like she said, there's really no side effects to Narcan other than the rapid withdrawal. So even if they were to give to someone who wasn't having an opioid overdose, there really isn't really a big downside. I've never met anyone that's allergic to Narcan or naloxone, so I think that it'd be fine. Yes, sir.
Is it wise to advertise or let other people know, your friends, that you have Narcan?
I think that's maybe a personal choice. It depends on what you feel comfortable getting involved in. I think if you were to tell your close neighbors, if you ever need it, we have Narcan, and that's something you're comfortable with, I think that's great. I don't know that I would drive around, say, the extreme end on your car saying, I have Narcan. Oftentimes, these patient populations come with a lot of other issues, other comorbidities, other illnesses, communicable diseases, severe mental health. Some of them, sometimes when they are given Narcan, if they withdraw quickly, they can be violent. So it's really what you feel comfortable with. I think that if you have a family member or somebody close that meets that population Amber talked about, I think it's really important, because the last thing you want to see is a family member or somebody important who die of overdose. But it's really, I think, maybe a personal choice. If that answers your question.
Any liability issues?
I think you're covered underneath the Good Samaritan Act, as long as you act that anyone with reasonable person with your level of training would act. If you receive Narcan training and it's documented, and you went and you put that Narcan into their eye and they lost vision, you could be held liable for negligence because you didn't follow your training. But if you had good intention and you do what you've been trained to do, you're protected underneath that law. Even us as first responders are protected underneath that law. As long as we do what any other reasonable person, as long as I did what any other reasonable paramedic would do, I'm protected also. Same thing with you guys. Yes, ma'am.
So Amber mentioned that you can get an Narcan with a prescription with or without a copay, or without a prescription too. So what's the over-the-counter cost of Narcan?
I'm not sure, to be honest. We receive ours through a medical direction, through a prescription from our doctors that work with us, and we get it through a supplier. I don't know what they're charging now. I know that in the past couple of years, there's been some shortages. I don't know if it's just on the packaging like some other medications, or if it's the fact that it's being so widely distributed that they hadn't caught up with the manufacturing. But as far as the price, I don't know. Do you know, Amber?
Around 150
Per what?
per dose.
Actually, there is a Good RX coupon, and with that, the price at least a year ago was about $20 with the Good RX. Many of my colleagues actually have been giving out coupons to the patients and their relatives.
I know that there's a lot of other agencies too that can help you get that, like H Project Worcester. There's a lot of other groups in and around the city too that can help you get dosages of Narcan for free.
So I know I see a few other physicians other than me here too. Are you guys prescribing Narcan to your patients whom you're giving opioids?
It doesn't require prescription. There's a standing order. They can just go. Give them the coupon and they can go and fill it.
They are advised to carry the Narcan if they are using the drugs. They should be carrying.
They should be advised to carry it.
So that they can, if they are using it, they can tell their friend that I'm going to be using this, so I have the Narcan just in case.
The prescription would just cover the cost, perhaps. Maybe their insurance would pick up if they had a prescription. Otherwise, they may have to pay $150 if they don't have the coupon.
Yes.
Yeah, if we do send the prescription out, which I haven't been doing to my
Even without the
outpatients,
prescription.
Yeah.
Question for you, actually, Doctor. Are you prescribing this only to chronic opiate users, or are you prescribing it to anyone that might get that for short term? Or
in my field,
yeah.
We are both oncologists, so many of our patients
so they're
are
using it chronically.
She
Yeah, I
will answer.
understand.
We provide that. We provide the prescription for the patients who have a problem with the opioids.
Okay. People who are being treated for dependency, things
Yes.
like that. That's great. Thank you. Yes, sir.
Are you advising community centers and other places like that, congregation places like churches and stuff, to have like available Narcan and people trained? Is this the trend?
I think it is. There's actually a few different things you're starting to see in places where people congregate. It used to be that you always found an AED in recent time, right, and a defibrillator that people would use for CPR. Now you're seeing stop the bleed kits, things like tourniquets, and now you're starting to see them carry Narcan. A good example, the public library in Worcester. I can't speak to specifics of how they organize, but that's often a place where maybe the homeless population congregates during the day. They've actually helped to provide services to a lot of those people there, and I believe that they carry Narcan also because they have that population. I think it goes back to what Emma was saying. Any place where you might find those at-risk populations is a good place to keep it, but really anywhere. I think that if you have, you know, a church, a library, a community center, and you're gonna have a lot of people congregating there, it may be a good idea to carry that.
So just to augment that, so towns or cities are providing some kind of help or some sort of a training and some sort of a material?
I don't know specifics. I know that there are some places that we've gone for calls where they will have them, and I don't know if that's been brought in by other agencies or if it's paid for by the municipality or the city. That one I wouldn't know.
I think to answer your question, I think Amber can like, where did you get trained and they provided you with a free dose?
That was AIDS Project Lister.
So it's meant for the public or?
So that's more meant for people who are working with either in fields where they need to have access to Narcan, or they have close relationships with people who are maybe opioid or drug users. So that's more for, because they give it for free. So there is like, that comes from the state government. So that is targeted more to people who have specific need for it, not just the general public.
I think that makes sense because I was talking to one of the patients and she told me a bag of opioid is $40, whereas Narcan is $150.
Mm-hmm.
So doesn't make sense. It's triple the price of opioid. They would rather go and buy the opioid than buy the Narcan.
Yeah, I think some of you have seen these patients too. One of the things we see in the street level is just the need of a lot of these opiate-dependent patients to get that that dosage every day in any means possible. You know, it's that you talk about the street price of, you know, like a half bag of heroin, maybe in the last couple months has been $20 to $40, depending on which dealer they're getting it with. And they need to, these people often wake up in the morning, and a lot of you know, something that we call, you know, maybe dope sick or having withdrawals. And if they don't find a way to get the next dosage, then they're sick. And, you know, oftentimes they may go to the hospital, they may come in with some other thing claiming to have chest pain, orthopedic injuries, to get painkillers and then leave without treatment. So it's difficult. I think places like AIDS Project Worcester that she was talking about, if any of you are ever looking for that, if anyone knows the Canal District in Worcester, where Green Street is, on the other side of Green Street, on one of the side streets is where AIDS Project Worcester is, which was started to help treat the AIDS population in Worcester. But they do a lot of other outreach services, like providing Narcan and things like that. I mean, you can see these agencies that have gone out and kind of reached these populations, so they're not looking for that fix every day and help with that. But I don't know if you want me to keep going, or you have anything else to add, or anybody else questions?
I wondered if Narcan had an expiration date and if you were having to replenish your supply.
They do. It depends. We don't always have to replenish it because we use it enough
Even if it's
to do it.
expired?
But like all medications, it has an expiration date. I don't know if it's an actual pharmacology issue that they're doing this, or if it's a manufacturer setting an expiration date. But we very rarely do we have to throw away Narcan and buy new Narcan. We use the older dose and then we replace it as need be.
Amber, do you have any place where you would suggest the pregnant women who are opioid dependent, you know, they don't want to come to the hospital? Do you know any place where they can go if they want to?
I would really say AIDS Project Worcester. I had the one-on-one Narcan training with them, and I met with I think the director there. She was a lovely woman. Everyone there was just very welcoming, non-judgmental, like a great source of information. So I would really just say AIDS Project Worcester. And as for the expiration, I know that the Narcan doses that I received had expiration dates on them, so I believe it's about 1.5 years before they expire, but you will see it if you have Narcan on the package itself.
Yes, sir.
Is it possible that Narcan can backfire and start being used as an opioid?
No, it's the way it works chemically that Amber talked about is it blocks those receptors that opioids use to cause their reaction inside the body. So it really couldn't work at all. I don't think there's a way they'd be able to abuse Narcan at all. Anyone else?
So, officer, I mean, like, seems like there's a problem, there's a solution. Both are. The problem is much stronger than the solution that you are providing is temporary. Is there a better answer to this question of solving this problem as a law enforcing agency? You know, I mean,
I think that that's probably something much bigger than me. I deal with the patient care side of it, and we don't deal with like the law enforcement side as much as they do. I think that's a national, global war on drugs issue that has many different sides to it. I think what we care about most, or what we are specific to, is making sure that person can be alive to get to the emergency room, or honestly be alive. Oftentimes they sign patient refusals and they go back on their business. And then trying to hook them up with services that may stop that. There's patients that I've seen from their very beginning of opiate dependency to being clean to finding them in cardiac arrest and not making it. So you can see that long-term progression. I think personally, it's just getting them the services they need. Sometimes it's getting their families the services they need to help provide that support system, or to help treat the other things that they may be. Oftentimes people are treating mental health with drug use, and if we can get them services for mental health and get them clean, then maybe they can have a better outlook on life later on. Amber? Thank you.
Thank you. So we also have Ms. Maury with us, who is the Executive Director of Shrewsbury Youth and Family Services. And part of that is also the Shrewsbury Coalition for Addiction Prevention and Education. So she is very involved with this, and she can really speak, I think, a lot about the prevention specifically.
Thank you. Good afternoon. As Amber said, my name is Christine Maury. I'm the Executive Director of Shrewsbury Youth and Family Services. How many of you know that we exist? Okay, not many. So we are right down the street here. We do have an outpatient clinic. We do lots of prevention and education work. First of all, thank you, Amber, for your willingness to tackle such an incredibly complex issue and to help us increase literacy in our community around Narcan. I want to take a little bit of a different perspective on this problem, a little bit in response to your question. So our amazing first responders respond to crisis, crisis, crisis. What we know is that addiction is largely a pediatric developmental disorder. Very frequently we see young people start to use substances as a maladaptive coping skill. When we talk about mental health issues and comorbidity or co-occurrence between mental health issues and addiction, we know that 90% of adolescents that have a substance use disorder have an underlying mental health problem that is not being addressed. So when we look just here in our community in Shrewsbury at the adolescent population, we know that 1 in 5 between 12 and 18 years old will have a diagnosable mental illness. We know that suicide currently is the second leading cause of death in 10 to 24-year-olds. So part of our mission at SYFS and through our Coalition for Addiction Prevention and Education is to really educate everybody in our community on how to identify young people that may be struggling with an onset of a mental illness or substance use or an emotional crisis. And really, until we can really identify the kids that are struggling before they start using the substances, we're never going to get ahead of this opioid crisis. So it is imperative that we educate. Parents are educated. We know there's a pretty specific path. It goes nicotine, marijuana, alcohol. We don't see 12-year-olds usually starting out with heroin, but we do see a vaping epidemic. We know that nicotine is a highly addictive substance. It's a problem everywhere. Shrewsbury is not immune to these issues or to mental health issues. So what I will offer is we do lots of training for parents and community members on mental health first aid that teaches adults how to recognize young people that are struggling. We do an adult program that teaches you how to use Narcan. So please, we are right up the street on Maple Ave in the UMass campus right here. Please do reach out to us. Also, if you go to our website, which is syfs-ma.org, we do have some videos on there. One in particular that would be helpful, I think, for this audience is Dr. Ruth Pody, who speaks about how addiction happens in the adolescent brain and why it happens. So it's about an hour long, so get a cup of coffee or tea, and please do watch that. And if you have any questions about mental health or substance use or any co-occurring disorders, please do reach out to us. We're right here. We're here to serve the community, and we are available. Does anybody have questions?
I do.
Okay.
So do you take like insurances?
We do. Yes.
So most of the insurance you take it,
yes.
If the patient wants to come.
Yes. Only outpatient, we don't do any
Yeah.
residential or intensive inpatient out. Yes.
I just want to take advantage of your presence and time. There are two types of people you have. One who are your donors, and the others who don't know you at all.
Yes.
So if you could
This
help
is
me,
true.
just 1 minute, just explain what are the other things SYFS do,
Okay,
so
yes.
for the benefit of the community.
Certainly. So in addition to our outpatient clinic, we have a large internship program where we have master's level clinicians that are placed in almost every Shrewsbury school and at Alhambra Academy. Those interns rather, see students one-on-one. They run social emotional learning groups. They respond to students in crisis. We provide wraparound services to the schools in Shrewsbury. So when the clinical teams in the schools have sort of reached their capacity, those families are referred to us, and that could look like anything from helping a family apply to secondary mass health to access services through TDS or the Department of Mental Health. We do case management, so we are a SMOC application site. We do emergency fuel assistance, emergency housing assistance, pretty much anything that you need. If you come in the door to SYFS, we have somebody that can help with that. Again, we run the Shrewsbury Coalition for Addiction Prevention and Education. The next event will be Thursday evening on the 21st at Shrewsbury High School at 6:30, and that is going to be a film made by students, for students, about the very dangerous activity of mixing prescription medications with alcohol. And that will be about a young man named Clay Silver from Winchester who took Xanax and had some beers with his friends while he was home from college and passed away. And his friends thought he was just drunk. So there will be a panel discussion moderated by our State Rep Hannah Kane, District Attorney Joseph Early, our Clinical Director Jennifer Rifkin, and Dr. Constrath, who is a local physician who will be there to answer any questions. Gosh, we run a big mental health first aid program. We've trained over 1,000 parents and teachers across the state of Massachusetts to recognize young people who are struggling, and in turn those people have linked 750 students in the past 3 years to the services that they need. Do you have a question?
What should you do if you see someone using a drug but they're not in an overdose?
If you're in school, you should go to your guidance department at school, and if you are home, tell a parent or a trusted adult.
What if you're by yourself with other people? Like, it's not your parents.
Like friends.
Like at a mall or?
Like if you're walking home from school.
Like the big, huge 150 students that go from Sherwood and Oak to Dunkin' Donuts. Do you hear that group?
Yeah.
So again, it would be best to, as soon as you get to an adult, share it with an adult.
Okay.
I know that's hard for students because sometimes it might be your friends and you don't want to rat people out, but it's really a very dangerous, even vaping, I'm sure. What school do you go to?
I go to Sherwood.
Sherwood, so I'm sure you've seen it.
Yeah. One time, I was coming home from school and there was like the 8th graders are at like the gazebo and you can just like see the smoke coming out.
Yeah.
So then I called my dad and I'm like, what do I do?
Well, first of all, good for you for not doing it and joining in. I know it's really hard, sometimes there's a lot of peer pressure, but it is a really, really dangerous thing. Not only is nicotine highly addictive in your developing brain, but there are chemicals in there that we don't know how they're going to be impacting. So we have a generation of kids addicted to nicotine and vaping now that in the next couple of years we'll be seeing the repercussions. So tell a parent, make sure you're educating yourself and your friends. And if you would like, I would be happy to sit down with you one day after school and give you some tips and things that you could say to your friends to encourage them to stop or to get help if they're addicted. We are always available, so anybody who wants to come in, just give us a call and come on in. We're happy. If you want to even come with a group of friends, we're happy to come and sit down with you and do that. Also, we just recorded with the UMass Department of Psychiatry, Central Mass Tobacco Free Community Partnership, a parent education program on vaping that is also on our website and on our Facebook page. So if you haven't seen that, take a look at that one as well. Somebody have a question here?
I do. So I appreciate you for bringing that up. That requires strength and courage. Great job. I also want to
future board liaison right there.
Also as a parent, because I heard from a friend and who is not a Shrewsbury resident, their kids have been through high school and all that. So she said, you know, she knows people who may be trading, who may be distributing among communities. So I said, you know, why don't you bring it up with the authorities? And she's like, but we know these people. The kids are friends with them. So they want to avoid any repercussions socially or in the town or anywhere. What do parents do with that information? I've seen resistance from parents bringing it up to police or bringing it up to the school and all that. And secondly, I wanted to add, we had another question before regarding having Narcan with people with opioids. I am a provider at nursing homes, and I know they require, in our e-kits, they require us to have Narcan through the DPH. So we have a lot of patients on opioids, so we are required. So maybe that's how we need to spread it more. In any case, back to the first question.
So,
what do parents do with that information?
So the best thing that parents can do, and we know that this is the most effective thing that parents can do, is to educate themselves. Make sure you're familiar with the products, the way it's delivered. There are lots of different products out there. Educate yourself and have honest and frank conversations with your children. Of course, I encourage parents to report if they do have information of somebody distributing, but in the case that they don't want to do so, the best thing you can do for your children is to be open and honest and discuss it with them. Make sure that they are aware of the risks that are involved. Make sure that they know very clearly that you as parents are opposed. Set strict boundaries and stick to them, because sometimes, especially when there are mental health problems with young people, parents can have a really hard time dealing with the volatility from their children. And we frequently see parents almost morphing into a sort of codependent role with their kids because they want to see their kids happy. So we really want you to set some firm boundaries and provide as much education as possible. And we have lots of information that you can come and pick up at the clinic just to hand to your children. It's available anytime, just stop by.
Is town planning on doing anything about these pot shops that are popping up everywhere? And are you prepared for what's coming your way?
So, there are 2 recreational facilities coming to Shrewsbury. They will be here in the summer. The town did not vote this down. This is a town vote, and unfortunately, we did not opt out as a town, so they are coming here. We have requested some additional funding from the state to assist us in our coalition for addiction prevention and education to try to combat that. Unfortunately, we work very closely with the schools, and our data comes from the school risk surveys that are implemented every other year. So in the 2017 data, we did see a 5% increase in high school students using marijuana, but I think even more alarmingly, a 5% increase in students that thought it didn't have any ill effects on them. So because of this is being so normalized now and even touted as healthy, yes, we are going to have a problem in Shrewsbury. So we are requesting funding and writing grants like crazy to try to assist us. We just applied for SAMHSA's Drug-Free Communities grant. So we're hoping to get that. We do collaborate with the surrounding towns with our coalition, and we'll do everything we possibly can. And if you have young people that you're worried that are using substances, please call us. Any other questions? Okay, I'll turn it back to Amber. Thank you so much.
So does anyone have just any more questions? All right, then thank you everyone for coming. I really appreciate your support. I hope that this helped you understand just a little bit better the opioid epidemic and what you specifically can do. And just a reminder that first link has everything that I shared in my presentation if you maybe came in late or if you just want to review what I said. But thank you.